Welcome to the Deep Dive. We're the place that takes heaps of information and pulls out the important bits just for you. Today, we're jumping into a really fascinating medical case study. It's a real-world situation that honestly shows just how connected everything in the human body is. Our mission, really, is to untangle this complex web of symptoms, long-standing conditions, and figure out what's truly going on. You know, it's funny, you look at a list of medical issues and it can feel pretty overwhelming, right? But when you start to sort of peel back the layers, you find these surprising connections and really crucial details you might just miss otherwise. That's what these deep dives are all about.
Yeah, and what's really illuminating here is how problems that seem totally separate, on the surface, they can actually be influencing each other quite deeply. So this dive today, it'll show you how digging into those details really lets us see the whole picture, the interconnectedness of it all.
Absolutely. So today, we're zeroing in on a 70-year-old woman. She's got a pretty complex health background. There's a history of high blood pressure, hypertension that hasn't been well controlled, also long-standing type 2 diabetes.
And we don't actually know her glycemic control for that diabetes, which is important.
Right. And add to that, some kind of unspecified heart disease that's caused her heart muscle to enlarge, cardiomegaly. Her main complaint right now, the reason she's seeking help, is a bad asthma flare-up, an exacerbation.
And on top of all that, some newer concerning symptoms have popped up recently.
Yeah, things like unexpected weight loss, feeling tired all the time, easy fatigability, and new swelling in both legs, bipedal edema. So quite a lot to unpack here. Let's get into this medical mystery. Okay, so our first big clue in this puzzle seems to be her most urgent problem, this severe asthma flare-up. She's apparently been struggling for about 3 days. Difficulty breathing, some chest pain, especially bad at night.
And she's using her asthma inhaler regularly.
Yes, regularly, but the symptoms just keep coming back. So what does that tell us? What's happening inside her lungs?
Well, okay, asthma fundamentally is about the small airways, right? The bronchi and bronchioles in the lungs. During an attack or an exacerbation like this, these tubes get hypersensitive. They narrow down quite significantly. Plus, the lining inside them swells up, gets inflamed, and often there's more mucus production too. All of that blocks airflow.
Ah, okay, so it's like a triple whammy narrowing the pipe.
Exactly. And when someone's asthma isn't controlled, they get that feeling of not being able to get enough air in, that shortness of breath, and that chest pain she's feeling. It's likely from the sheer physical effort of trying to pull air through those tight airways, probably not her heart in this context.
So her body's just working incredibly hard simply to breathe. That makes a lot of sense. And the fact her inhaler gives some relief, but only temporary? What's the significance there?
Oh, that's a really crucial sign. Her inhaler likely has two kinds of medicine. One's an anti-inflammatory, probably a steroid, and the other's a bronchodilator to quickly open the airways. The fact she gets some relief tells us the drug types work for her, they do help. But the quick return of symptoms, even though she's using it often, is a very clear signal. It means her current asthma treatment just isn't strong enough to manage this flare-up.
So her underlying asthma control is poor.
Precisely. It's not under control. She needs what we call a step up in her treatment plan. That likely means a stronger, maybe short-term burst of anti-inflammatory medication, like oral steroids, to really break the cycle of inflammation and constriction.
Okay, so we've got a plan for the immediate breathing crisis. But like you said, this isn't happening in isolation. Things get a lot more complicated, maybe even thicker, when we factor in her long-term heart issues, that uncontrolled high blood pressure, the enlarged heart, and now this new swelling in her legs. This is where the real detective work starts, isn't it?
Absolutely. What's particularly critical, you see, is how long-standing, uncontrolled high blood pressure puts just a tremendous constant strain on the heart. Think of it like a pump that's always pushing against way too much resistance in the pipes. Over years, the heart muscle has to compensate. It works harder, gets bigger, thicker. That's the cardiomegaly, the enlarged heart you mentioned.
Right.
But this actually makes it less efficient. It's not necessarily stronger, it's just bigger and often stiffer.
And the swelling in her legs, the bipedal edema, that's often like a big red flag, isn't it? A warning sign that the
Yeah.
heart might be struggling to pump blood properly, causing fluid to back up.
Exactly. It's a classic sign. When the heart isn't pumping efficiently, blood can sort of back up in the system. This increases the pressure in the veins, particularly in the lower body because of gravity, and fluid gets pushed out of the vessels into the surrounding tissues. Legs and ankles are common spots. It's a common sign of heart failure developing or worsening.
And that failure could be because the muscle is too weak or too stiff.
Correct. It could be systolic dysfunction, the pumping action is weak, or diastolic dysfunction.
Mm.
The heart muscle is too stiff to relax and fill properly between beats. The latter is actually quite common in older folks with that history of chronic hypertension.
Okay, now here's where it gets really tricky and I think fascinating.
Hmm.
We know from her notes she's taking a specific blood pressure medicine, amlodipine. And that particular drug, well, it's actually known for causing leg swelling, is a fairly common side effect.
Yes, it is.
So for the doctors managing her, how on earth do they figure out if this new swelling is just, a harmless drug side effect?
Yeah.
Or if it's something much more serious, like her underlying heart failure getting worse?
This is an absolutely critical distinction to make. It's paramount, really, and it comes down to careful clinical detective work. See, amlodipine causes swelling because it relaxes the tiny arteries, the arterioles. This can lead to some fluid pooling in the lower legs, which is usually, as you said, harmless, though maybe annoying. But in someone like her with an already enlarged heart, possibly borderline heart function, you absolutely cannot just assume it's the drug.
So you have to look for other clues.
Exactly. Doctors would be looking for other signs of fluid overload, signs pointing more towards heart failure. Things like listening to her lungs carefully for crackling sounds that suggests fluid backing up there, checking the veins in her neck to see if they're distended. Even listening to her heart sounds with a stethoscope. Sometimes there's an extra heart sound, an S3 gallop, which can be a key indicator of volume overload due to heart failure.
So it's really about building a bigger clinical picture, not just looking at the legs in isolation.
Precisely. And you'd want tests, too, diagnostic tests that look directly at the heart and its function. An echocardiogram, an ultrasound of the heart, would be absolutely essential. It shows how well the heart's chambers are squeezing, the ejection fraction, and how well it's relaxing. They'd also likely run a blood test for BNP, or NT-proBNP. That's a hormone the heart releases when it's under significant strain, particularly in heart failure. Levels tend to be much higher if the heart is truly struggling.
Right, so those tests help differentiate.
Yes. If those tests confirm the heart is struggling, that her heart failure is worsening, then just stopping the amlodipine isn't enough. Her blood pressure meds would likely need changing, maybe to something that offers better heart protection, like an ACE inhibitor or ARB, perhaps a beta blocker. And she might need diuretics, water pills to help her body get rid of that excess fluid.
But if the tests are okay, and it really does look like just the drug,
Then, it might be as simple as switching her amlodipine to a different class of blood pressure medication that doesn't typically cause that kind of swelling. It's a much simpler fix, but you have to rule out the heart failure first.
okay, that makes sense. Now, let's not forget her other major condition, type 2 diabetes. That's not just sitting there quietly, is it? It plays a big role in potentially making everything else worse. She's on metformin, but we don't know her blood sugar control. And those symptoms like weight loss, feeling tired all the time, they're pretty general, but they can be linked to diabetes, can't they?
Oh, absolutely. Uncontrolled diabetes is incredibly damaging systemically. It damages blood vessels, both the big ones and the tiny ones, all over the body. This damage directly worsens existing high blood pressure, makes it harder to control, and accelerates heart disease processes. It's a major risk multiplier.
And the weight loss and tiredness.
Well, yes, while they are nonspecific, they can be symptoms of poorly controlled diabetes. If your body can't use sugar effectively for energy because of insulin resistance or lack of insulin, it might start breaking down muscle and fat, leading to weight loss and fatigue. But, and here's the complexity again, those exact same symptoms, weight loss, fatigue, are also classic signs of worsening heart failure. The body's just generally struggling.
So they overlap completely, making it even harder to pinpoint the main driver without more information.
Exactly right. It really highlights why getting a handle on her blood sugar control is so important.
And you mentioned her metformin dose. The notes say it's quite low. What does that usually signify?
That's a very astute observation. A low dose of metformin like that suggests it might be inadequate for her needs now. Metformin is a great foundational drug for type 2 diabetes, but often, as the disease progresses, or if control isn't good, the dose needs to be increased. Or, very commonly, additional diabetes medications need to be added on top of it to achieve good glycemic targets.
And thinking about adding medications, some of the newer diabetes drugs actually have other benefits too, don't they? Benefits specifically for the heart.
Yes, this is a huge development in diabetes and cardiology over the last decade or so. It's all about connecting the dots. There are classes of drugs now, like SGLT2 inhibitors and GLP-1 receptor agonists that were developed for diabetes, for lowering blood sugar, but clinical trials have shown they have incredible benefits for the heart and even the kidneys, too.
How so?
Well, for instance, SGLT2 inhibitors have been shown to significantly reduce the risk of cardiovascular events like heart attacks and strokes. And importantly, they reduce hospitalizations for heart failure. They also have a mild diuretic effect, which could potentially help with that leg swelling we discussed. And they offer kidney protection.
Wow, so a single medication could potentially help her blood sugar, her heart failure risk, maybe even the edema slightly.
Potentially, yes. It's about finding treatments that tackle multiple problems at once, which is ideal in a complex patient like this. It's really changed how we approach treating diabetes in people with heart disease.
Okay, so pulling this all together, what does this mean for the overall management plan? How do doctors approach someone with so many overlapping issues?
It really demands a truly comprehensive and integrated approach. You can't just treat one thing in isolation. So for the asthma, the immediate priority is clear. Step up the treatment aggressively, get that breathing crisis under control, likely with stronger anti-inflammatories. Stabilize her first. Then, for the hypertension and heart disease, the absolute key is figuring out the cause of that leg swelling. Is it the amlodipine side effect, or is it worsening heart failure?
Because the treatment path diverges significantly based on that answer.
Exactly. That dictates whether you simply switch the blood pressure med or if you need to start thinking about heart failure therapies, maybe diuretics, maybe different classes of antihypertensives that also benefit the heart. And then there's the diabetes. We need to assess her actual blood sugar control, probably with an A1C test, and then optimize her medication. That likely means increasing the metformin or very possibly adding one of those newer agents like an SGLT2 inhibitor given her heart disease history to get both blood sugar control and those crucial cardiovascular benefits.
It really sounds like juggling multiple interconnected pieces, a constant process of assessment, adjustment, reassessment.
It is like a complex puzzle where moving one piece affects all the others. You have to keep the whole picture in mind constantly.
This deep dive, it's really driven home how no medical condition just exists on its own, in a vacuum.
Hmm.
Our 70-year-old patient, her asthma, her hypertension, the heart disease, the diabetes, they're all tangled up together.
Yep.
And her current meds and these new symptoms just create this really complex diagnostic challenge and a treatment challenge too.
Absolutely. And if you step back and think about the bigger picture, this case just highlights so strongly the importance of taking a holistic view in medicine. You see a symptom like leg swelling, bipedal edema could be something relatively minor, like that drug side effect we talked about,
Mhm.
or it could be a sign of something very serious, like worsening heart failure. The implications are vastly different.
Yeah.
So it really forces doctors to be detectives, doesn't it? To look beyond the most obvious explanation. And it raises that fundamental question: how many layers do we need to peel back before we truly understand what's happening with a patient and figure out the best way to help them?
That's a great point. The insights we've talked about today, pinpointing the cause of the edema, the need to step up the asthma treatment, thinking about optimizing diabetes meds, not just for sugar, but for the heart. It really underlines the critical thinking that's needed. It's a powerful reminder of just how intricate the human body is and how nuanced medical practice have to be. So for you, our listener, maybe here's a final thought to chew on. How often, maybe in our own lives, do we look at a symptom or maybe just a problem we're facing and jump to the most obvious cause, when actually the real story might be a much more subtle interplay of different factors working underneath the surface? What other areas in your life perhaps could benefit from that kind of deep dive approach to really try and uncover the underlying connections?